Ready.
Knock, knock, knock. Wash my hands. Hello, Mr. Warnock. My name is David. I will be your student nurse today. Can I have your name and date of birth?
My name is Kevin Warnock, July 14th, 61.
Excellent. I would pull the curtain for privacy. Your name and date of birth does match your wristband. Bed is at a comfortable working height, a safe height. As I come into the room, I would inspect the area for any tubes, lanes, lines, drains, or any respiratory equipment that might be a tripping hazard to either myself or my patient. Excellent. Well, Mr. Warnock, today we're going to be doing a head-to-toe assessment, just going over your various body systems from head to toe. Do you have any questions for me before we get started?
I don't.
All right, cool. You don't have any questions for me. I do have some for you, though. Have you had any recent mood changes?
Nope.
All right, any anxiety or depression?
Nope.
Good. Any thoughts of suicide or homicide?
No.
Excellent. And as far as in your home, do you feel safe when you're home?
I do.
Awesome. My patient does appear to be well groomed and in good hygiene. His attire is appropriate for the situation. Alrighty, Mr. Warnock, a few more questions. Have you had any dizziness or headaches?
No.
Awesome. Any difficulty getting to sleep or staying asleep?
Nope.
Alright. And can you tell me who I am?
David Warnock, my student nurse.
Excellent. And can you tell me about what time it is?
It's about 11:30 p.m.
Awesome. And can you tell me where we are?
We're in Boise, Idaho.
Cool. And can you tell me why we are here?
We're here because you're going to do a head-to-toe assessment.
Excellent. Yeah, I nailed it. Awesome. If you could just go ahead and grab my fingers and give them a nice solid squeeze, you won't hurt me. Excellent. Strength is equal bilaterally. We'll do something similar with your legs if you just want to go ahead and press up against me. Awesome. Excellent. Strength is good. Next, Mr. Warnock, we are going to go ahead and go over your head, eyes, ears, nose, and throat. So beginning with your head, I'm going to feel on your head, palpate your scalp. You let me know if you feel any tenderness. Excellent. Excellent. Any tenderness?
None.
Awesome. Patient's scalp is free of any bumps, irritation, scars. The patient's hair is full, thick, and evenly distributed. Excellent, Mr. Warnock. Next, we'll go over your eyes. I notice you're wearing glasses. Have you had any vision changes recently?
No.
Excellent. Awesome. The patient's eyes do appear to be free of any redness and free of any irritation. Excellent. Now I'm going to shine my light in your eye. If you just want to go ahead and look at my finger for me. Excellent. Awesome. Patient's pupils are equal, round, and reactive to light. If you just want to look at the tip of my pen now. Excellent. Awesome. Thank you very much, Mr. Warnock. You said you haven't had any recent changes in your vision. Next, I'm going to inspect your ears. Your ears appear to be free of any damage and free of any excess drainage, no irritations. Can you hear this?
Yes.
Awesome. Can you hear this?
Yes.
And do they sound the same?
They do.
Excellent. Have you had any recent changes in your hearing?
No.
Awesome. Next is your nose. Your nose does appear to be straight. I'm going to shine my light up your nose now. Excellent. Your nose appears to be free of any excess drainage. Your septum is straight and not deviated. All right. Next, we'll go ahead and inspect your throat. If you just want to go ahead and open your mouth, say ah for me.
Ah.
Excellent. Your throat is free of any irritation. Palate is soft. Mucous membranes are all pink and moist, including your mouth and your nose. Next, I'm going to go ahead and have you smile for me. Excellent. Thank you very much. Your teeth appear to be straight, white, and are intact, free of any damage. Awesome. All right, Mr. Warnock, next we're going to go ahead and go over your respiratory system. Have you had any difficulty breathing or any shortness of breath?
No.
Good. And that is confirmed. I do see that my patient's breathing is unlabored. Awesome. I note that my patient's skin color is appropriate for ethnicity, no redness, cyanosis, paleness. My patient's AP to T ratio is 1 to 2. Excellent. All right, Mr. Warnock, I'm going to go ahead and listen to your lung sounds now. If you just want to go ahead and give me a nice deep breath at each place I place my stethoscope. Excellent. Thank you, Mr. Warnock. Go ahead and let me know if you do get lightheaded. We are going to go ahead and do the same thing except on your back now. So if you want to go ahead and lean forward for me. Excellent. Thank you very much, Mr. Warnock. Lung sounds are clear to auscultation. No wheezing, stridor, extra lung sounds. Wonderful. Your skin does appear to be pink and appropriate for color, ethnicity. No signs of edema. Wonderful. Next, we'll go ahead and go over your cardiac system. Have you had any well, before I get that far, I am going to go ahead and inspect your trachea at the midline. It does appear to be straight. I'm going to go ahead and palpate it. Excellent. It does appear to be straight at the patient's midline. The chest, both in the front and the back, appears to be proper size. No bumps or bruises. No barrel chestedness. Excellent. All right, go ahead and so we'll go ahead and get into your cardiovascular system. Have you had any chest pain?
No.
Excellent. All right. I'm going to go ahead and listen to your heart valve sounds now. So I am going to begin with your aortic valve. Just go ahead and breathe normally for me. Excellent. Followed by your pulmonary valve. Followed by your tricuspid valve. Excellent. Followed by your mitral valve. Excellent. And while I am over your mitral valve, I'm going to go ahead and listen to your apical pulse at the point of maximum impulse for a full minute, starting now. Excellent. And your heart rate is 73 beats per minute, and that heart rate is regular. Wonderful. Moving on now, we are going to go over your peripheral circulation. So if I can go ahead and have your wrists, I'm going to go ahead and check your radial pulses. Excellent. Patient's pulses are equal and bounding bilaterally. Next, we'll do the same with your feet, with your pedal pulses. Awesome. Pulses are equal and bounding bilaterally. Next, we'll go over your capillary refill in your fingers. So if I can have your fingers. Excellent. And capillary refill is equal and within 3 seconds. We'll do the same with your toes now. Excellent. And your capillary refill in your toes is also equal and within 3 seconds. Awesome. I noticed that your skin does appear to be warm and color appropriate for ethnicity. You are free from edema, so circulation does appear to be working well. All right, Mr. Warnock, next we're going to go over your gastrointestinal system and your genitourinary system. So just a few more questions for you. Have you had any pain in your abdomen?
No.
Any difficulty breathing?
None.
Any trouble with your genitals?
No.
Excellent. All right. A few more questions. Have you had any nausea, vomiting, or diarrhea?
None.
Awesome. And when was your last bowel movement?
This morning.
All right. And have you had any changes in your appetite?
No.
All right. Good. Next, I'm going to go ahead and inspect your abdomen. So if you want to go ahead and lay down flat for me. Excellent. I do notice that the patient's abdomen appears to be flat and free from distension. Excellent. I will go ahead and auscultate your abdomen now, Mr. Warnock, listening for any bowel sounds in all 4 quadrants. Excellent. Bowel sounds do appear to be normal, and the giggling was not a problem.
Tickle.
Excellent. Awesome. Bowel sounds are normal, not hyperactive, not hypoactive. They are regular in all 4 quadrants. Next, Mr. Warnock, I'm going to go ahead and palpate your abdomen. You go ahead and let me know if you do have any tenderness. I'm going to feel for any masses, any bumps or tenderness. Feeling okay?
Yes.
Excellent. Also going to palpate the bladder, and there are no signs of any masses or distension. Awesome, Mr. Warnock, if you want to go ahead and sit up for me. That concludes that portion. Next, we'll go ahead and get into your musculoskeletal system. So first, performing some range of motion. Can you put your arms straight out to the side and straight up above you? Cool. Maybe some small circles. Excellent. Awesome. Thank you very much. Next, can you stick your feet straight out in front of you for me? Awesome. And spread them apart. Back together. Can you pull a knee up towards you? Cool. And the other one? Awesome. Thank you very much. Range of motion appears to be sound. Excellent. Next, we'll go ahead and do some strength tests. So if you want to go ahead and put your arms straight out like this for me, go ahead and do a bicep curl and pull me towards you. Excellent. And push me away. Excellent. Awesome. Go ahead and hold your hands straight out like this for me. Push me down. Excellent. And flip them over and push me up. Excellent. Strength is equal bilaterally against resistance in the upper extremities. Awesome. We'll do something similar in your lower extremities. If you want to go ahead and push your feet straight out for me. Excellent. And pull them back towards you. Excellent. And if you want to go ahead and bring your toes to your nose for me. Excellent. And press the gas pedal. Awesome. Patient's musculoskeletal system in the lower extremities appears to be equal bilaterally and free from any pain. How are you feeling, Mr. Warnock?
Good.
Excellent. All right, next we're going to go ahead and assess your gait. So if you want to go ahead and stand up for me and maybe walk over to the fireplace over here. All right. Awesome, and on back. Cool. Any pain as you're walking?
None.
All right. And while I have you standing up, if you want to go ahead and reach over towards your toes for me and assess the curvature of your spine. Excellent. Thank you very much. You can stand up. Go ahead and have a seat. The patient's spine appears to be straight and no signs of abnormal curvature like kyphosis, lordosis, or scoliosis. Excellent. That concludes the musculoskeletal system. Lastly, we'll go ahead and go over your skin. Your skin does appear to be dry, warm, and color appropriate. Your skin is free from any bumps, bruises, irritation, rashes, scars, lesions, wounds in general. Have you had any itching or irritation?
No.
All right, excellent. All right, Mr. Warnock. Oh, and lastly, we'll go ahead and assess your skin turgor. Small pinch here, this won't hurt. Excellent. Skin turgor appears to be equal bilaterally and immediate. Patient appears to be well hydrated, good circulation, good skin. All right, Mr. Warnock, I think that concludes our assessment today. Do you have any other questions for me?
I have none.
All righty, excellent. Well, I will go ahead and make sure you have your call light. Make sure your bed is in a low, safe position. If you have any trouble or any questions, just go ahead and hit that call light. I will be around. Thank you very much, Mr. Warnock, and have a good day.
Thank you.